like to bring on our next guest on the program, Dr. George Bennett, CEO and founder of Good Measures. George, good morning.
Good morning.
Hey, nice to have you on the program. Appreciate you spending time with us today.
Thank you. I appreciate the opportunity to be with you.
So how are things in Boston today?
They're cloudy, but it's the first day of fall, and it appears to be a decent day, but a little bit cloudy.
There you go. Well, again, nice to have you. George, before we kind of take a deeper dive into some of these elements here, talk a little bit about the background and the vision of Good Measures and what you guys are doing in this space, please.
There is significant evidence that nutrition that good nutrition dramatically improves the performance of a person's immune system, healing system, and weight management system. And there's a lot of evidence, if you have those things working better, that all the biometrics from weight being under better control to blood pressure, glucose, cholesterol, and a variety of others. So what we're up to is trying to find and have found, we think, a practical, straightforward way to help people achieve nutritional balance and get those benefits. So we're committed to improving the incidence of healthy outcomes from daily living and from specific events, and we've made some pretty good progress.
When did you roll this out, George? When did first Good Measures first come into the market?
We have been doing a series of pilots and research. We've spent some $22 million forming small pilot groups to understand when what the role of a registered dietitian or professional should be, and what the role of digital technology might be, and how those should interact. So we've been active at that for a variety of years. We've been in the marketplace for about the last 24 months, and we are, pursuing a variety of channel strategies ranging from health plans and self-insured employers to retail pharmacies to pharmas and, to others.
And I should remind our audience too that you're not inexperienced in this space too. You were one of the co-founders of Health Dialogue many years ago.
That's correct.
You understand the space. You've been around this space for quite some time.
I do. No, I was the chief executive there, one of the co-founders and the chief executive there. And when that was sold, there were some 24 million people who had access to the Health Dialogue services, and we did analytic work on 34 million on a database with 34 million lives. So, that past firm laid the foundation to a lot of the professionals that are now at Good Measures.
Talk a little bit about the participant experience, if you would, George.
Okay. It's interesting. I was listening to the earlier part of the show today about personalization. There's a lot of emphasis in the work we're doing. The participant launches the activity with a conversation with a qualified professional, which in our case is a registered dietitian. And a registered dietitian is a part of the clinical provider community, and therefore under HIPAA and other laws, an integral part of the clinical experience. And so their first experience is to have a conversation where the registered dietitian, through that inquiry and through some questions that they answer on the digital app, learns about their age and their gender, their medical conditions and their medications, so that the registered dietitian can make up a very personalized nutrient needs template. Now, the participant doesn't need to worry about the details of that, but we track some 30 nutrients and we have peer-reviewed sources of what the nutrient needs are by age, gender, segment, and we modify those based on medical conditions and medication. So what the patient experiences is a warm and fuzzy conversation with a registered dietitian, and then either by logging into a digital app that we've developed or by in conversation with the registered dietitian, the participant helps us understand the foods they eat. Now, it's fascinating. Of the tens of thousands of food that are available to most of us eat fewer than 200, and as our research progresses, it now looks like it's even less than 150. So if they log for a few days or a few weeks, or talk to the registered dietitian so they can log on their behalf, we get a good record of what they eat, when they eat, what their food preferences are. So then what we do is make food recommendations, meals, snacks, and other recommendations that are out of the individual's food set. So their experience is they have a person who helps them set little goals and big goals. They help us understand what it is they eat and how they like to eat. And then from that set, we make recommendations that help them meet their nutrient needs. Now, to make it interesting, and is also part of the technological strength, we have invented a thing called the Good Measures Index, which is an indication of how well they are meeting their nutrient needs. So on a scale from 0 to 100, and if their index is 97, it means that of all the things they have heard about on radio, TV, and in the things they've read related to how much fiber they get, the percent of their calories from protein, percent from carbs, percent from fat, how much calcium they get, vitamin C, vitamin D, how they shouldn't get more than a given amount of saturated fat or sodium or others. That complex array that they get inundated with of what all they should do, this little index says, if it's a 98, good job, you're doing it all. And if it's a 24, it says probably lay off the beer and pizza and try to get back and eat a couple real meals, or whatever the sin they've done to get down in the range of 24. So their experience is they see this little index, and then the most potent part of the things we have developed is that we go up into the cloud with some very sophisticated math, look at the foods they like and eat, look at what their nutrient needs are, look at how they've been eating for the last few days, and we actually can identify out of the foods they like the meals that are good choices for them to consider at that moment in time. So they get two things. They get this little index, and then we have this digital app that's on a cell phone or on a smartphone of either Android or iPhone, and it's also available on the web. They tell us what they are eating, and it comes back and says, for your next meal, here would be here are 5 meals that would be good for you to consider. If you eat one of those, your index will go up, and what your index going up means is you are doing a better job of simultaneously meeting that array of things science suggests you should be doing. So people find that very helpful. Our end goal to finish the participant experience is that with a few weeks of work, it is our goal to have them have 5 default breakfasts, 5 default lunches, 5 default dinners, 5 default snacks that are better go-to defaults than they started with before their experience with Good Measures. And those default meals will have a strong tendency to have them in better nutritional balance with all of its benefits than they were before they started. Whatever the question was, that was the answer.
No, it's very interesting, George. I appreciate it. Tell me about your go-to-market strategy. I mean, is this a direct-to-consumer and also a direct-to-employer and health plan and other model? I mean, how are you taking this to market?
Well, the material the approach we have developed appears to have wide applicability, and we appear to have a broad set of distribution channel partner opportunities. So we are selling to health plans. And an example of that would be Tufts Health Plan in Boston, which is ranked on some metrics #1 in the nation, who has made commitments to make it available to all of their members and to also make it available to their employees. So they are strong supporters of the excitement that this new approach generates and are applying it. We also go direct to employers. We, for example, are working with Putnam Investments here in Boston, and they make it available to their employees. And in both of those, we are paid on a fee-for-service basis, the way a Health Dialogue or others who supply health and wellness products are paid. They pay a fixed amount for providing that service, which is usually spread over about a year. There's a 12 to 15-month intensive period of interaction, and then availability for questions and answers and a little bit of nudging out for over a year. So we are going directly to health plans, and we are going directly to self-insured employers. We are not direct to consumer. We are doing it through health plans and employers. We are, though, looking at other channels, and other places where the technology is potent. This work we've been doing has great potential for pharmaceutical firms as they work hard to be more outcomes focused. So they want to be able to give a patient a pill and support that in fact will do whatever the pill is intended to do. And this happens to be a very useful complement to that kind of arrangement. So we have a variety of those kinds of conversations going. So this might get integrated through some of those channels. We also
I'm sorry.
Go ahead.
Go ahead, George. I'm sorry. Go ahead. No, finish it. That's fine.
No, that it was just a different topic. I haven't checked to see how active you'll have been in discussing the diabetes prevention program, but the CDC and and Medicare and others are working to in case there are those listening who don't have familiarity with it. Basically, Medicare plans beginning in January of 2018 to pay for preventive services for pre-diabetics. There are 86 million of those people in this country in desperate need of this kind of preventive support. By CMS designating a program that's been developed by CDC and others as relevant, they've now announced that they'll let CDC qualify who's capable of delivering the service, and then Medicare will begin paying in 2018. That support has translated into a variety of self-insured employers and health plans paying for diabetes prevention services immediately, and Good Measures also has a diabetes prevention service program, and are working with people like the employees of the city of Albuquerque with that program.
George, it's been great having you on the program today, and really appreciate the time as always. Leave our audience with a few takeaway points, if you would, please.
To repeat where I was in the beginning, or where I started, there is substantial evidence that improved nutrition, and that is that broad set. It's not just eating a salad kale at lunch. This is nutrition as defined by getting adequate fiber, right distribution of protein, carbs, fats, getting not too many saturated fat, not too much sodium, but getting adequate D, etc. Broadly defined nutrition correlates strongly with an improved immune system, improved healing system, and better functioning immune, better functioning healing, and better functioning weight control. So people under good nutritional control have fewer cravings, can lose weight, and they also have those other benefits. The trick and complexity of of the task, though, is how do you do from 15 to 30 of those nutrient rules simultaneously? What Good Measures has done is invented a technology which involves this index I mentioned in order for a person to be able to do that to do all those nutrients simultaneously by eating the foods the guy likes to eat, which is a big breakthrough, and it's delivered by email, text, phone, and video conferencing. So there are huge benefits. There have been obstacles in the past to do more than one or two nutrients at a time. There is a way now to do multiple, and the results we're getting from randomized trials and from observational studies are that we're getting dramatic reductions in A1C, in glucose, in cholesterol, and blood pressure, and a variety of other things that we'd all like to have in better shape.
That's great, George. And the market can find out more about you at goodmeasures.com, correct?
That's correct, yeah.
George, great to have you on the program.
Thank you very much.
Look forward to talking again soon. You have a great weekend.